morning, everybody. Welcome once again to our Thursday tea. It's the 27th of June 2024, and we are going to be talking about malaria in the tropicals today. But before we go forward, we are going to be talking about how to stay prepared in this rainy season and some of the things you have to have as you gear up for the season. When you're on the road, when you hit the road, when you are even in your offices or wherever is your business point, there are certain things you should have at hand, because when it's the rainy season, of course, it always comes with the rains and the change in road system, the change in climate, the change in your temperature, everything. So you definitely have to be ready. I'm Jennifer Jinko, your wonderful host, and with me is
Pharmacist Adama Akano.
Pharmacist Adama Akano. Is she not looking beautiful today? Her white sleeves and please don't blush. I'm just complimenting. Of course, Adama is our very beautiful guest. Always giving us wonderful points on how to stay prepared, how to stay geared, how to keep our body systems in check. Okay, so let's go over to our tea talk. Today we're going to be having Lipton Yellow, of course, a black tea, a brand of black tea in Nigeria, and on it we're going to be talking about how to stay prepared. So how do you think we can stay prepared in this rainy season?
Well, rainy season comes with a lot of things, as we know, but the first and foremost would be to have the basics, which would be, if you live, depending on where you live and the condition of the place, make sure you have nets, like the door nets, to help to mitigate mosquitoes from coming in, because you know that when rainy season comes, the breeding of more mosquitoes. You can also have rain boots for people that live in area where it easily gets flooded. So the rain boots will help you to obviously access your house and also keep you safe, especially if you don't have a means of transportation, be it car or bikes or whatever. Another thing I would also recommend is to stay on top with your multivitamins, because at the end of the day, the most important thing is health, your immune system, your immunity. So you should be on top with your multivitamins and your vitamin C, especially our pearls and our these two products will give you the best outcome that you're looking for. I'm sure that with these three things you can also prepare, and remember that this list is not an all-inclusive list. It's just a few things that we think that are necessary. You can also add, pick and choose and remove based on your particular location and what is peculiar to your environment.
Thank you very much, Madama. So in addition to everything she has said, of course, your usual umbrellas, you need to carry it everywhere you go. Even if you're a car rider, you need to have your umbrellas.
Because the rain can catch you.
I'm telling you, in fact, this season has been quite unpredictable. That's the funny thing with it. You're just staying and the sky is clear. You know, before we used to know how it will rain with the change of weather and everything. But now, if you don't even look at your phone to see the forecast and you're just mind thinking, you can't exactly predict if it's going to rain or not. Talking about the weather management, and that thing you should also do is to keep your skin locked. I understand it's cold, and you know when it's cold, especially with people with skin pores. Like I have a lot of skin pores, so people are hairy and they have skin pores, so you have the tendency to catch cold easily and all that. You can make use of balms, you can make use of ointment, all those things to lock your skin, just to stay warm.
We didn't even talk about raincoats. You know, it's a thing, and it's something I don't see people using a lot.
I'm even surprised. Back in the days, people
it was
used to
everywhere.
Really
like on rainy days,
I'm telling
people
you,
will come out with colors.
Yes.
Like you're seeing people everywhere.
I don't know why it's like that. Whether the markets are not selling, I don't know what the issue is.
I think
it's not just a drive for people these days.
Yes, I think it also has a lot to do with the fact that I think people don't really walk to places as they would back in the day. Like there are other easier means of transportation. People can move around. There's bus, like from bus stop to bus stop.
That's true. So these are some of the things that could influence. However, we just encourage you to stay prepared. Always take something warm in the morning, like your hot tea or hot beverage, whatever choice you may have. Or black tea, green tea, all that will also keep your immune system in check. So let's just take the right things along with us so that we can stay prepared. We don't have to shake in the cold or feel drenched and all that. Thank you very much. Okay, so let's go back to the main topic, malaria in the tropicals. What is malaria?
So malaria is a disease or an infection caused by Plasmodium, and is being transferred from one person to another or transferred to humans by mosquito, the anopheles female mosquito. And if we know anything, we should know that malaria is a disease of the red blood cell, meaning that the Plasmodium will actually attack your red blood cell and get you infected.
Thank you very much, Madam. Thank you very much. We always define malaria every time we're talking about malaria topics because it is important for you to know how the issue starts. You have to know where it starts from, to where it's going to, what makes it what it is, and then what can actually solve the problem.
Yes.
So that's why we always define it. So we are going over to malaria in the tropicals, if I'm not wrong. So let's talk about that generally, especially as it influences an area like Nigeria.
Nigeria. So we, being that we live in the malaria endemic zone, which is Nigeria, and when I say endemic, it just means that everybody here, you know how when you go to the hospital, the doctors tell you that we all carry some level of malaria in our blood because this is something we are constantly exposed to, like in our day-to-day commute, in our day-to-day life. So when it comes to Nigeria as a location, you should know that the weather and the times affect you should know that the weather and the time or the season affects the prevalence of malaria at a particular time or at that particular time. Like as we are in the rainy season right now, there is a high prevalence of malaria right now because there will be cases of flood and puddles and things that will be a breeding ground to these mosquitoes, which would in turn increase the incidence of malaria in our homes, in our place of work, in our places of worship. Like you can literally be exposed to mosquitoes anywhere. There's no saying, even sometimes, even after you've done or taken all the necessary precautions, you will still be exposed to malaria. So even in the car rides sometimes you could see, I don't know if it's happening,
yes,
like I've been inside a taxi once at night, and next thing I'm like, mosquitoes are actually really
sometimes I feel, I don't know if they self-breed, like as if even without them penetrating.
Yes, I think that's something that should actually be looked into. You know that there are very few, I think very few living things that can self-breed, like breed by themselves. And I think maybe we should look into
mosquitoes.
Yes,
specifically.
mosquitoes.
Because sometimes I suspect that.
Because
sometimes you can be so sure that, okay, this zone or this area or even this car had no mosquitoes, so how did it?
Yes, and maybe from just one entry.
You understand? You are just in like 5 or more than. So that's another thing, but that's aside for another day. And for those who do the research, of course, over to you. So thank you, Madama, for sharing some tips with us on mosquitoes and malarias in the tropical zone of Africa, Nigeria specifically.
You're welcome.
So of course, Nigeria is a tropical area. We are waterlogged, of course, in some areas like Lagos. We have Bayelsa, we have Warri, places that.
I think I actually beg to differ. I think the water runs across
all the states in Nigeria.
It's just, yes, I think it's mostly about how much it impacts the state.
Exactly.
Or how close to civilization, maybe the river or the whatever it is. Because look at River Niger.
That's true.
River Niger flows. I think there's a direct connection from River Niger to which other?
We have Benue. We have River Benue. Oh, okay, you mean the bigger oceans like Atlantic, Pacific?
No, not even. I'm just talking about Nigeria. Okay. Like now, the third mainland bridge.
Oh, okay.
What would you call that?
I think it's called that water in the third mainland bridge connects to the Atlantic Ocean.
Yeah. So what would you call that water? Like you know how River Niger is on the bridge of Niger Bridge, like the bridge that connects Onitsha to Asaba. That river is called River Niger. What would you call the one on third mainland bridge?
I don't really know.
Okay, you don't.
I haven't. Yes, I haven't. Really.
Because if you look at
you just say Lagos Island.
Yes, because if you look at the geographical map, the river or the water one, you would see that these waters they connect in every state. Like if you're traveling to like maybe even Calabar, the north, there's some
connection to everything.
Geographers. I'm sorry if I'm murdering your terms, but I know that there's something like maybe confluence, there's just somewhere
that confluence,
the water meets and just keeps going.
Of course, I agree with you. It's just that some places are more water dense. That's the point I'm trying to make than others. And of course, where the water is more is where mosquitoes definitely have stronger chances. Like you can compare the mosquitoes you find here in Lagos to maybe mosquitoes you find some places in the east.
Yes.
You might go to some places in the east
not
and
even some places, almost everywhere.
Almost everywhere.
Would you believe that in the village, like when you travel to when I say village, that's what I think maybe abroad or white people would call, I think you call it countryside.
Oh, okay. Maybe.
Like that. I'm not sure. But like when you travel to the more rural areas, you notice that you can be outside. Like you can literally sleep outside the whole night.
Because of the calm and lack of parasites.
Mosquitoes.
So the places like that.
I found that so bewildering.
There are places like that.
I found this so baffling.
But sometimes when I go to the village, I really find situations of mosquitoes. I'm talking about because of mosquitoes.
Yeah, that's what I'm saying. Even in mine, like there are no mosquitoes. Like I find this.
You can get other insect bites, but
yes, maybe
maybe
like sunflies and all
like
those
sunflies,
things.
of course.
But mosquitoes is definitely a no-no. Like it's
most times.
it's an amazing.
I don't know if the season contributes because usually I'm home sometimes. Yes, during the Harmattan season. But however, anywhere that is water dense is water dense. Lagos is almost every time we battle mosquitoes. You can't even escape it. So thank you very much, Madama, for contributing more to that. Let's go over to the symptoms of malaria. So what are the possible symptoms? We say possible symptoms because sometimes malaria shares related symptoms to other kind of course conditions. So what are the possible symptoms of malaria?
Okay, so some of the possible symptoms you might experience if you're down or about to be down with malaria could be headaches, body aches, like feeling of pains in your joints. You could also experience shivering. For some people, you start shivering uncontrollably. So for some another thing you might be able to experience, or you may or may not experience, could also be some people might come down with a cold. This is not, as we said, this is not an all-inclusive list, as Jennifer said, because you might experience some things, you might not. In some cases, some people might also come down with high fever, like running really high temperature. So these are some of the basic symptoms that you can experience when you're about to have malaria.
Okay. Yeah, I know some people experience the more regular ones, loss of appetite. Some people, the moment they just lose appetite, they just say, this is my most common symptom of malaria. You know, how people assume this thing, but we always advise you go for a test to be sure, because loss of appetite, there are other health conditions that can come with loss of appetite. But I know the average Nigerian thinks that loss of appetite.
There are even some people that will just have a headache, maybe due to stress. Maybe you've had a long day, or you've been on the road, you've been driving the whole day or something, and at the end of the day you have a headache, which is normal because you're stressed out. But no, this is my sign of malaria. In fact, you say, I need to treat malaria
right now.
Because once I have malaria, typhoid
as in, I don't even know how they do that.
We are just special.
Please, let's be very careful. And sometimes they actually take the medications to this, and they just feel alright. But sometimes I think it's a psychological issue. It's a psychological issue. It's not
even down to like when they go to the pharmacy and you're trying to explain to this person that, oh, I think you should run a test first. You know, I don't think that you have this and this or what you're claiming.
Yeah.
They'll say, are you me? Do you know my body more than me? I'm telling you something I've been doing.
But that's another thing. Having patients outrightly defend the situation of their health. Even when you even run a test and I tell them, see what we are saying, they'll be telling you, no, this is not going to work for me. I know my body.
You know that's.
Please, let's learn to listen to our medical practitioners.
Yes.
It's very, very
that's
important.
one of the biggest challenges in healthcare.
Yes, especially in Nigeria.
Yes, because it's like, where do you draw the line between a patient saying, I know my body, I know something is wrong, I know this is how my body has been working or operating, and you as a medical professional trying to convince that person that this is what the medical book says. This is what, according to how things are meant to be. This is
How we can go
how we
about
can
it.
go about it. So it's always
It's fine. I hope that someday we will reach the line, and it's by educating our audience just the way we keep doing in our Thursday teas and our Monday health hacks.
Yes.
You have to keep listening to your medical practitioners. As trust me, they know what's best for you. Your diagnosis and test will also be an evidence to what could possibly be going on in your body. So don't say or assume that this could be happening. Sometimes giving the wrong treatment over time can pile up to create a different health condition for you guys unexplainable. So this is another part that needs to be taken note of. Thank you very much, Madam. So on our next point, let's talk about some of the possible solutions to malaria. What can we use as a cure to malaria? Give us instances. We also advise that you recommend brands on.
So when it comes to treatment of malaria, there are a couple of treatments that I call regimens or plans that are in place or people go to. So especially here in Nigeria, the first line of treatment should be the ACTs.
Of course.
Yes. So those are the first class of drugs that comes to mind when you want to treat malaria. And by ACTs, I mean artemisinin combination therapy. So that's the first. And if you for history purposes, the combination therapy was put in place because it was noticed that the single therapy regimens that were used in the past had more side effects, had more severe side effects on the patients after treatment.
Okay.
So, the goal of medicine is to constantly ensure that the patient's outcome outweighs the risk at every point in time, every point of treatment plan. So, you don't want to be treating somebody for maybe you're treating someone for malaria, and then at the end of the day, I give the person liver failure or kidney damage, that kind of thing. I'm not saying that's the case, but I'm just giving a bogus example of that. So that's why the combination therapy, which are better handled by the body and also more effective. So it also reduces the prevalence of drug resistance and gives us a better outcome medically. So that's one of the important. And one of the most common ACT combination is artemether-lumefantrine. So, and this comes in different doses because this can be taken by both adults and children, even infants. So we have a very beautiful brand, a perfect one called Lisonic Fort. So, and this comes at 8480 and is a combination of artemether and lumefantrine. And this is very easy to take and very easy to adhere to kind of medication because it is a 3-day dosing regimen and it has to be taken just 2 times in a day. You also have to talk to your pharmacist in order to understand the timing because this particular drug should be taken at specific time with specific instructions. We also have our Lisonate Fort comes as tablets and as suspension. The suspension, which is for children, should also, it's important that while discussing with your pharmacist should be aware of the age and the weight of your child because this will help in the proper dosing to ensure that your child is getting the required quantity for the best outcome. We also have the injectable variant, but this is strictly based on your doctor's advice because it's not an OTC, so it must be given a prescription and must also be given by a professional, a healthcare professional. So make sure you talk to your doctor or your pharmacist before you consume any drug.
Thank you very much, Madam. Okay, so in addition to that, it comes in tablets and it comes in suspension for babies, of course. And of course, there is an injectable variant, but that is limited to what your doctor would have to do with it, especially when he has checked the level of malaria that you have in your body system. Okay, thank you very much, Madama, for sharing all these wonderful points with us. You can follow us on our social media handles. Thank you so much for joining us. This program was brought to you by Linet Pharmaceutical Limited, and we always enjoy sharing very valuable health points with you.
Yes.
Thank you, and hope to see you once again.
Yes.
So let's have our tea for Madama. Thank you.
Bye.
Yeah, we should share.
Bye.